All right, welcome to the show today, guys. Today I'm going to take on a subject that any man should know something about. Now, it's a subject that if you're a married man, if you're around daughters, which are, as a lot of you know, I have three daughters and a wife and a mother-in-law. And my practice is very female oriented. I treat everybody, as you know, but women tend to take better care of themselves. So they tend to go to chiropractors at a higher rate than men. And I have mainly female staff of all different ages. So in being in that experience, to understand how the female mind works is always fascinating to me. It's wonderful. And today I want to touch on one of those things, menopause, because I came across a really interesting study and a speaker who was going on about what she had discovered. And she was a neurologist. She is a neurologist, wonderful person. And she had done a research study on the link between menopause and the symptoms associated with menopause and the Mediterranean diet. And she found that people that started eating the Mediterranean diet that were in menopause did much better. And so we're going to talk about that today a little bit, some of the basic stuff. I'm not going to get into great details because you can go on forever on the topic on the herbals and vitamins and minerals and hormone replacement therapy, meditation, saunas, all the healthy stuff. And healthy stuff makes you healthier. But to get more specific and go after this condition directly is a pretty tough topic. But I think I'm able to do it and give you some basic things for that. One of the issues with menopause in the scientific community is most of our studies are at least partially done on animals. And the odd thing about animals is they tend not to live past their reproductive years, where humans do. Now you go back 200 years and you can argue, how long people lived, but a lot of people, there is some decent evidence that we didn't, at certain points in history, didn't live beyond, our 40s into our 50s. Men and women. The environment was tough, disease was rampant, nutritional problems probably were a big part of that, feast and famine and, conquering the environment and what have you. But animals tend not to live much beyond the reproductive years, so we have trouble doing studies on them. So the studies are done by more observational studies done on women. But the first thing to understand is let's just get a quick definition. Menopause is basically 6 months to a year without a menstrual cycle. The year is really more accepted. And that comes from a decrease in mainly estrogen as the ovarian tissue starts to produce less over time. And that usually means that a woman is, less likely to get pregnant, and because the cycle isn't happening, the uterine lining isn't making itself viable for the implantation of an egg. And in that situation, that would all be fine. But the problem is we're now seeing a link between Alzheimer's and menopause. And women are having twice the amount of Alzheimer's that men have in studies. So in that situation, we're looking at it. What is it that's causing that? Is it something dramatic about how the hormones change? Because if you look at a basic XY graph, let's say, of the decrease in hormones in men over time versus the decrease in hormones in women over time, the sex hormones, testosterone for men, estrogen for women, you're going to see a very slow but steady decline of testosterone in men. And the symptoms from that are pretty simple. They're not difficult. It's not really a rough ride. A loss of energy, some body fat, lower libido, basic things like that, some muscle mass issues, of course. But it isn't a horrifying ride. It isn't very dramatic. It's just kind of a bummer. Where when you look at what women go through, when they have that menopausal reaction, the estrogen drops dramatically. And the number of symptoms that go with that is dramatic as well. They're miserable. And we'll make a list of them. There's 36 common symptoms of menopause, and I'll just fire those off real quickly for you in a minute. But to understand that, this dramatic change in a woman's body can be brought on simply by age and time, the old biological clock concept, or it can be brought on surgically. And unfortunately, women have to have, with cancers and certain conditions, they have hysterectomies, and the ovarian tissue is taken out, and they're put into like a surgical menopause, and very dramatic situation. And oftentimes hormones have been used to dull that out, and there's been mixed results with that. And you may have seen studies in the 90s and in the early 2000s of elevations in breast cancer with the hormone replacement therapy. But there's a time and place for it, and that isn't really my world, but that's something that you can look into. One of the interesting things in studying this was that brain energy changed. So as men lose their testosterone slowly, they certainly lose some brain energy, and women were losing it dramatically. And in a 5-year period, some of them have lost 30% of their brain energy. Now, brain energy isn't just your overall global energy, but it's related. We can actually be seen on different imagings of the brain. They were able to image a woman's brain when she was in her late 40s. And then after menopause, I think it was 5 years later, they looked, 5 years into menopause, she lost 30% of her brain energy. And that became very interesting because what does that mean? Women tend to outlive men. They don't seem to have the cognitive decline that men do. I look at my practice just observationally, and men seem to lose more of their cognitive ability. They're a little slower to answer. They have bigger memory issues in general than women. And I notice women, even in their 70s, they're just buzzing in circles around their men. And so if they're losing brain energy, how is that possible? But it turns out they're not losing cognitive ability, just energy. So they end up just as smart and fast as they were, maybe a little less, but they're tired. So making it through the entire day becomes more fatiguing. So they have the symptoms of brain fatigue quicker than a man has symptoms of brain fatigue in a similar age, in a similar situation, because the hormones are part of the energy. So estrogen, remember, estrogen is linked to brain function, and brain function is linked to estrogen. So if something is damaging to the brain, the estrogen pays a price. If something is damaging to the estrogen, either a menopausal situation or surgical or not, the brain pays a price. So they're intimately linked, and the thyroid is linked in there, and that's why you see weight gain with menopause. So we want to take a good look at, what can we do about this? Even though there's a stark difference between how men and women go through this, soothing some of the exhaustive list of symptoms in women would be a fantastic idea. So I'm going to read a list to you of some of the 36 different things that can go on in a woman's body from experiencing menopause. And, none of them are fun. Men get off easy on this, but let's start. So, number one, people say hot flashes, night sweats, irregular periods, and then the absence at some point, dramatic mood changes, breast soreness, decreased libido, vaginal dryness, headaches, tingling in the extremities, burning in the mouth, changes in ability to taste food, general fatigue, like we talked about, brain energy and fatigue, bloating, abdominal, digestive disorders in general, joint pain, muscle tension and aches, electric sensation shooting through the body, general itchiness, sleep disturbances, difficulty concentrating, memory loss, thinning of the hair, brittle nails, weight gain, stress incontinence, inability to hold urine in under stressful situations like, coughing, laughing, sneezing, dizzy spells, allergies increase, osteoporosis, the symptoms associated with that, irregular heartbeat, unusual body odor, irritability, depression, anxiety, and general panic disorders. Years ago, women were diagnosed as having all kinds of mental disorders associated with the common findings of menopause. And you can imagine with that list, if you had half of those, you might think you're going crazy, but you're not. You're just experiencing some changes in estrogen levels in your body. Okay, so if we're going to look at brain energy, we're going to look at how do we get it healthy? What can we do here? Okay, so let's start out by always, and in my podcast, I always want people to realize mastering the fundamentals is crucial. So we want to get enough sleep. Okay, I know that's something I say all the time, but it's worth doing. You want 8 hours of sleep. It's still really the way of going. And getting to bed at 9 and getting up at 5 has been researched to be the ultimate for everybody, and that includes women in menopause. Stress levels, right? Reducing stress, because cortisol and estrogen are related. Now, cortisol is a hormone that's released when you're stressed out, and you pay a price for having that in your body. It's not good, and that will decrease your estrogen. And when you have low levels of estrogen, because estrogen doesn't disappear completely in menopause, but it goes down dramatically, you really don't want to have cortisol in there diminishing what little is left. And like I said earlier, as far as food goes, Mediterranean diet seems to win on this. At least that's what the research says at this point. And you can look up what's in the Mediterranean diet. I'll touch on a few things, but it's best just to make a list, stick it up on the fridge, shop that way, make some of those recipes. But, you know, as you would know, the Mediterranean Sea, so it's the countries surrounding the Mediterranean Sea. Italy, Greece, Spain, and Israel have the diets that are associated with this. When people go on the Mediterranean diet, the all-cause mortality, meaning the death from all causes, goes down. Cognitive decline decreases, depression decreases, heart disease, stroke decrease, cancer decrease, and hot flashes, one of the things we mentioned, has also shown to do that. Well, what's in the Mediterranean diet that's so good? One of the things they found was that the phytoestrogens, we may have talked about this in another podcast, phytoestrogens are plant compounds mainly that can fire an estrogen receptor on your cell. Remember how the body works. No drug or substance would work and do anything to your body if you didn't have a receptor on the cell to accept it. So the estrogen receptors on cells all over your body fire at a certain level when there's estrogen in the body. A phytoestrogen fires it a little bit less, but it still fires it. So when you're firing estrogen with less of a dramatic sort of situation, less dramatic, less power, let's say, your body can be normalized. High levels of estrogen and some of the ups and downs when someone is in the prime of their menstrual cycle, it can also be helped by phytoestrogen because it plugs some of the receptors and the real estrogen can't get in there because there's so much estrogen, you're overdoing it. In this case, there's so little that the estrogen receptors are wide open and ready to have some estrogen, but there isn't enough in the body. So we start eating these compounds. Now, healthy fats are associated with this as well, but let's look at the phytoestrogens. Flaxseed, sesame seeds, dried apricots, chickpeas, and dark chocolates are really good phytoestrogens, but there's loads of other ones. Basically, eating a lot of plants has a lot to do with just getting the phytoestrogens in there. It doesn't mean you're a vegetarian in this situation. The Mediterranean diet is not a vegetarian diet, but there's a lot of meat and vegetables, and certain ones. Now, the fats have a lot to do with it. Now, you'll notice a lot of the phytoestrogen foods also carry omega-3 fatty acids. So we want to actually supplement those or make sure we're eating enough of those. And those are really commonly found. The omega-3s are found in fish. Salmon, sardines, anchovies are the main fish that they're found in. But once again, the omega-3s, the flax seeds, chia seeds, and walnuts have good omega-3s. And you can look up and find, omega-3s. Simply taking a fish oil supplement can do that as well. The vitamins D, C are also very important for normalizing estrogen physiology. But we want to make sure that we also use a couple of adaptogen herbals. Now, an adaptogen is something that, and you can hear the root in there is adapt. It basically can take your body and normalize the highs and lows. So if someone is to take ashwagandha is one of my favorites. That's an adaptogen herbal. Now, what that does is that can bring down some of the overpowering effects of estrogen when someone is more estrogen dominant in their reproductive years, and it can rise up the estrogen components of your body when it's really low. So taking ashwagandha is very important at this stage of the game when someone's in sort of a menopausal, having the physiology of menopause, to make sure that the estrogen stays powerful in their body. And holy basil is another one. That helps with cortisol levels. We talked about cortisol and estrogen being inversely proportional, meaning when one's high, the other one's low. And, if you're not going to have a lot of estrogen, you're going to have, and you're under a lot of stress, you're going to end up with cortisol levels that are high. And the detriments of that are pretty massive. You can research cortisol. It's a whole nother topic, how to manage your cortisol levels. But, allowing the nervous system to be at peace, meditation, prayer, deep breathing exercises, even doing things that bring you joy, things that bring you like euphoric reactions actually don't do that as well. But things that are sort of peaceful and easy, those are things that will help with bringing cortisol down. Okay. So I guess pretty much what I'm saying here is the simplest way to approach menopause is to just do a couple simple things in summary. We want to make sure that we have the Mediterranean diet as our primary diet. And included in this will be one of those food pyramids with the foods of the Mediterranean diet in there. So what to emphasize and what to de-emphasize. So it's small amounts of certain grains, And there's a lot of the foods that carry omega-3 fatty acids in their fish, and the vegetables for the phytoestrogens you'll see in there. We want to make sure we master the fundamentals, the sleep and the stress control, and understand that with menopause there's also an amount of acceptance. With age, there's an acceptance of age to a point. And that's a tough one for a lot of people. I have people on one end that just give up. They're like, I'm this old and this is what happens and that's all I can do. And other people that are in absolute denial. And both of them can get themselves in trouble. I've been accused of being in denial here and there. A couple times I've overdone things, especially in the exercise department. So we want to make sure that we're being reasonable. But the only way to be reasonable is to do some research. Listen to these podcasts. I'll guide you through all that. We should probably have one called Age Appropriate Exercise and Diet, but there's a lot going on there. So that's it for today. I just want to make sure you got a really brief, unlike a lot of our podcasts, overview of the relationship between menopause, the Mediterranean diet, omega-3s, and how to manage cortisol. And, if you like these podcasts, we put together a class on ChristopherUniversity.com. You can look up. It's 28 Days to Optimum Health. You watch a small 6-minute video once a day for 28 days. And each one comes with PDFs, and you can really life-changing stuff in there. So every day you get a small amount of something very, very important to ponder and to put in your life. You can baby step your way to being like superhuman by the time it's over. So you can go to our site, Christopher University. We put together an online university now. And look at the class, 28 Days to Optimum Health. I've spent a lot of time just getting rid of the static, right? Getting rid of the volume of stuff that's out there. So narrowing it down like I did with menopause today, try to get it, cut it to the chase, because these topics can be exhausting. So one of my roles in these podcasts, as well as the classes we're going to be putting together, is to summarize, right? Get the 6-minute version of changing your life. Okay. So that's it for today, guys. Thanks again. And if you like these, give them a thumbs up, subscribe to the station, and leave comments. Be happy to hear some ideas for topics. If you want any particular subject related to health, be glad to cover it and grab a guest and get him on, he or she on, and bring you to the next level. Thanks.